The water jet is a gentle, soft system, able to separate particles like the wind blows the petals of a dandelion. To shape breasts with fat of the body instead of implants or flaps is an issue of growing interest. Basically, we infiltrate the tissue with Klein solution to anesthetize the donor site. This happens gently with a water beam, able to daze the parts of the body concerned. All this is done to enable this treatment without general anesthesia. The recipient side is anesthetized in the same way. The water jet beams in the 4 basic quadrants of the breast to drug the recipient side once more to enable the surgery in local anesthesia and sedation. To harvest the proper tissue, large fat lobules are gently divided into smaller cell clusters of less than 1 millimeter of diameter, able to survive in the recipient tissue after transplantation. While the water jet divides the cell clusters, the suction is performed at the same time to harvest the microfat grafts to be transplanted. The sacked area shrinks just as after conventional liposuction. The fat is sucked through a tube in a collector. Due to quick decantation, time-consuming centrifugation is avoided and we got best fat quality. The harvested tissue is brought up in a 50 cc syringe through a narrow opening of the cover of the collector without any exposure to the air. It is transferred to 10 cc syringes to handle with smaller units. If we would centrifuge these 10 cc syringes, 80% of the content is fat, so that about 20% have to be subtracted to get the clear volume. Augmenting the breast, we never touch the gland. All the fat is transplanted in the pectoral muscle area and in the subcutaneous layer. Here we see the micrograft transplantation underneath the skin and underneath the gland. The right breast shows a visible augmented shape compared to the left side. While the nurse prepares the 10 cc syringes, the left breast is filled with autologous microfat grafts respecting the muscular and subcutaneous layer. Small patches cover the opened wounds and compressment garment is required over the donor areas. The breasts need warmness. We achieved it with cotton, but no pressure for at least 10 days to give the micrografts space to survive. A clinical trial investigated the results. 200 patients since October 2007 were treated with this system. for primary augmentation, for reconstruction after cancer or genetical defects, for refinement after visible edges after prosthesis implantation, or after implant removal due to capsular fibrosis. An MRI was performed on every patient before operation and half a year after lipofilling. Breast size measurement was performed with a computerized MRI evaluation, and standard photo documentation was, of course, standard. The volumetric calculation of the MRI was analyzed with a neuronavigation software called BrainLab 1 Plan 2.6. The study found out that the mean survival rate was 76% after half a year. Some examples. This 24-year-old lady wished an augmentation of her breasts. In the first session, we put 200 cc's per side in the breast. This was not enough for her, so that in the second session, 260 cc's per side were implanted. This is the result 1 year post-op. The MRI half a year later shows that the fat ingrowth was underneath the skin and in the muscular area. This 36-year-old patient, after 3 pregnancies, wished to get rid of her laxy abdominal skin. We sucked her fat of the underbelly and transplanted it in the breasts. This is the result half a year post-op, with 100 cc's per side. This thin patient had cancer on her right breast. She refused a latissimus dorsi reconstruction, so that we tried to harvest fat on her. We were able to gain 150 cc's on her knees, flanks and underbelly. This is the result 1 week post-op and 6 months later. The MRI shows also here that the fatty tissue is still inside the breast half a year later. The results are stable, even after 3 years, and also after 4.5 years, the fat is still inside the breast. This young patient had liposuction of her hips and flanks. The fatty tissue was transplanted to augment her breast and to shape the body. The microfat transplantation shows stable results in wrinkles, in lips, in breasts, for hand rejuvenation, for scars, for buttocks and the thighs. The water jet system is efficient, it is gentle, it is clean, it is quick, it is German.